Now, I'd just like to ask President Peter Manzano to call to order the meeting.
Thank you, Andrew. Good afternoon, fellow Rotarians, our lovely aunts and guests. I now call this 23rd regular meeting of the Rotary Club of Makati to order.
Thank you, President. Okay, so at this juncture, we'd like to start the actual talk for this meeting. Rotarian George Barcelon, please introduce our speaker for today.
Yes. Good afternoon, President Peter, my fellow Rotarians and aunts. I have the pleasure of introducing this guest speaker this afternoon. I don't know her very long. I met her during the 5th month of our quarantine. You remember, to give you a timeline, we had March up to August. We had the first 3 months was the enhanced community quarantine, and then it was relaxed a bit to MECQ. And if you remember, during the month of August, the medical frontliner has clamored that it's too soon for us to be MECQ. So President Duterte decided to revert back to enhance community quarantine. During that time, of course, the private sector were a bit concerned that why the suddenly reset to the enhanced. Because once we go back to the enhanced community quarantine, the economic activities practically slowed down by about almost 70 to 80%. So I got a call from, or I discussed this with the Secretary of Finance, Secretary Sain Dominguez, and we were asking what was the reason for this reset. And he suggested that the private sector meet up with the medical frontliner and the medical sectors. So that's how I got to meet her, because during that time, we provided sort of a platform to listen to their complaints. I mean, in the business sector, we want predictability. When we got shifted back to the enhanced, we were at a loss. So having said that, she was one of the member of the steering committee of the healthcare professional, and she joined us during that meeting. So just to give you a brief background on our guest speaker today, she's a member of the Advisory Council for Center Medical International, which provides strategic direction for business operations and corporate affairs in the area of primary care. She was a program director for the Department of Health and served as medical director for Eastern Visayas Regional Medical Center, which was responsible for hospital operations for Super Typhoon Yolanda. She was also the chief architect of EBRMC's Build Back Better program. She now serves as independent consultant for various international organizations and national agencies and corporations. A doctor of medicine, Dr. Espina has 2 master's degrees, one in hospital administration and another in public health. She is also a fellow in the Philippine Academy of Family Physicians and a member of Philippine Society of Philippine Health Physicians. As a member of the steering committee of the Healthcare Professionals Alliance Against COVID-19, she has played a significant role in shaping the narrative of the COVID response. And today, she's with us to share with questions that may arise in this in government effort in getting the various vaccines for our citizens. So fellow Rotarians and guests, my honor and privilege to introduce our guest speaker, Dr. Aileen Riel-Espina. So without further ado, it is my honor and privilege to introduce her. Dr. Aileen Riel-Espina. Thank you very much.
Thank you, Sir George, for that kind introduction. So allow me to share screen, please. Okay. So, first of all, I would like to thank Sir George for giving me this platform this afternoon. In the very short span of time that I have known him virtually, hindi pa po kami nagkikita personally. Um, I have such great admiration for him and the rest of the leaders in the business sector for your commitment po in helping our country get back on shape uh, amidst the pandemic. In his introduction po, there is something that I would want to share with the group before I proceed to my talk. Last night, I posted in Facebook my happiness in being here with you this afternoon kasi this is not known to many. I was a Rotary scholar for my medical education. I was a scholar of the Rotary Club of Chiba-chu, Japan, and my father was a former Rotarian, Rotary Club of San Juanico. So it took me 25 years after graduation from medical school to finally speak before a Rotary Club. And it is very ano po sa akin, this is a very significant event for me because I feel that is my way of paying it forward. So, maraming salamat po. And to the Rotary Club President, Sir Peter, salamat po sa invitation to Sir Don, no, for facilitating it, and to all the members of the Rotary Club of Makati and to the other Rotarians, guest Rotarians from the other Rotary clubs. Magandang hapon po. Maupay nga kulop. Ako po ay from Tacloban City. And also I would like to say thank you to Rotary Club of Makati for all the help you have extended to my beloved city in the aftermath of Typhoon Yolanda. Alam ko po marami po kayong naitulong sa amin. So as mentioned by Sir George, ako po ay miyembro ng Healthcare Professionals Alliance. We were not complaining actually. We were just saying that before we reopen the economy, before we shift to or go to GCQ, we felt that there were some things in the COVID response then in August that needed to be recalibrated. Ang feeling po namin noon, meron pa pong napakalaking room for improvement in order for us to make our response more efficient and more responsive. So, the HPAAC is an alliance of healthcare professionals. We number more than 100. So, it's not just doctors. We also have in our membership the professional organizations of nurses, midwives, medical technologists, dentists, among others. So, nag-bond together po kami because we felt that the medical community deserved to have a seat in the table. We felt that we needed to amplify the voices of our compatriots in the ground from all over the Philippines. May mga bagay po kasi minsan na hindi po nakikita ng nasa taas at kailangan po namin yung bigyan ng boses. So in our desire to heal and save lives, we tried to become a strong voice in order to catalyze clarity and alignment in public policy. I don't know if some of you are familiar with the Health in All policy framework, pero lumalabas na po siya ngayon na lahat po ng desisyon natin, whether it is in information communications technology, in transportation, in business, lahat po yun may kaakibat na health component. It took this pandemic to finally open the eyes of people that health is something that cannot be solved by the Department of Health alone, but rather it should be a whole of society approach. Whole of society engagement po ang kailangan. We are a voluntary group. We are non-partisan. We speak only when we feel that our voices are needed. So, wala po kaming political affiliation, wala po kaming kinakampihan, wala po kaming pinapanigan. So we try to engage in dialogue, and this is our dialogue process. And it is in one of those meetings that I got the opportunity to meet, interact, and work with Sir George and the group that he is leading. And I would like to believe that those discussions that we had were very productive, and we were able to shape the the narrative po, like the National Action Plan, tapos yung ngayon po sa COVID response, we are part of the reorganized response cluster. I also see in the room po kanina, nakita ko po pumasok si Sir Jun Palafox. Very early po during sa ECQ pa lang, our group was working with them in coming up with the design and layout for the community isolation units. So, we have been working po because we really believe that kailangan po lahat tayo maiaambag sa usaping ito. Ito po yung pinopropose namin noon na guide to economic recovery. The 4 Bs, which is sorry po, may pumasok. Bureaucracy, bytes or information technology, and behavior. Why biology? Kasi po, evolving ang mga nalalaman natin tungkol sa COVID. Pero, talamak din po ang fake news. Every day, there are more and more discoveries about it. But we have to be careful in sifting through the information that we are getting. Kasi po, may mga studies na lumalabas, but we need to make sure that the result of those studies are valid. So there is really a process of evaluating scientific material and scientific evidence. Yun po yung role na ginagawa po namin sa HPAAC. We help in sifting through the evidence. Then, the very important role of bureaucracy, and this is what I was saying about the health in all policy framework. We have been advocating for digitalization. Kahit po ngayon sa US, lumalabas po na yung very important role ng ICT in monitoring and in the implementation of the vaccination program. We have so much technology available that we really need to harness to make our response more efficient. And lastly po, the last B is behavior. This is an infectious disease. And very, very important po dito ang behavior ng lahat ng tao. That's why po, HPAAC launched its Apat Dapat, Tatlo Sapat campaign. Ito po yung inaano namin na to empower people so that they would know how to behave. That they should always wear mask and face shield properly. That they should limit the time of interaction to as short as possible. That they should be mindful of the airway, of the air circulation rather, or the ventilation. And of course, that they should be mindful of the physical distance that they are when they are interacting or when they are in public spaces. Ito po kasing ito, pag naisapuso natin at naisabuhay po ito, magiging madali for people to behave as we resume our usual or normal activities. Magagawa po natin, sasabihin natin, dapat sa simbahan, maganda ba ang ventilasyon ng hangin? Maganda ba ang daloy ng hangin? Dapat sa isang pew, ilan lang yung magkakatabi. Siguro si Father, dapat ang misa less than 30 minutes. Tapos lahat tayo nakamask. So, yun po yung namin, yun po yung ibig naming sabihin o ibig naming ma-achieve with this campaign. This is actually taken from this Swiss cheese respiratory virus pandemic defense model. In this pandemic po, it will take several layers of interventions para po tayo maging more effective and efficient. So as you can see po, this is our personal responsibility. Andito po ang bakuna sa huli. So nandito po yung apat dapat. Okay, ayan po, no? A, which is the air circulation or ventilation, the physical distancing, the wearing of the mask, and the time of interaction. Vaccines ay nasa dulo na po. Okay? Kasi po itong apat na to, itong iba, kaya po natin yang gawin habang hinihintay po natin ang bakuna. And since vaccines are also not 100% effective in preventing the spread of infection, yung paghawa-hawa, we still need to follow these apat dapat kahit na available na po ang bakuna. Okay? Now we go to vaccination. We all were very happy when we heard, lalo na kagabi na nakita natin sa news, may paparating ng bakuna. Dahil, isip natin, pag dumating na yung bakuna, magkakaroon na tayo ng herd immunity. Pag nabakunahan na ang more than 50% of the population. We all know, and you, Rotary, very well know, na kung gaano po ka-epektibo ang bakuna in preventing certain vaccine-preventable diseases like polio. Your End Polio Now campaign is very, very effective. Okay? You have successfully participated in this global polio eradication initiative. And I think I will be preaching to the choir here if I continue harping about the importance and significance of vaccination. Because your club and the rest of the Rotarians in the world have already experienced firsthand kung gaano po ka-effective ang pagbabakuna in the eradication of vaccine-preventable diseases. But I think based on your experience as well, you would agree with me na meron po tayong attitudes and behaviors towards vaccine na kinakaharap ngayon. So if you look at this continuum po, ito po yung mga tao na nagdi-demand mabakunahan. Ito yung okay lang silang mabakunahan. Ito yung nag-aalinlangan kung magpapabakuna ba sila o hindi. At ito po yung ayaw magpabakuna. Itong pinaka-extreme, nandito po yung anti-vaxxers. Hindi lang ayaw nilang magpabakuna, kundi they're even convincing other people na wag din magpabakuna. So, this continuum po is something na kinakaharap po natin ngayon sa bansa natin. Okay? Even among healthcare workers, this was a sectoral survey among healthcare workers presented by Dr. Eric Tayag last week in a seminar over Zoom. It was hosted by UP Manila. And as you can see po, hindi po 100% na kahit ang healthcare worker mismo, may nagsasabi pa rin ayaw nilang magpabakuna. Bakit po kaya? Ano kaya ang mga dahilan na kahit yung mga healthcare worker may pag-aalinlangan tungkol sa pagpapabakuna? Actually, we're trying to address this issue because this is not very good role modeling. Because one of the sources of information and one of the sources ng kapalagayan ng loob ng isang pasyente ay kung ang kanyang doktor o ang kanyang kaibigang healthcare worker ay magsasabi sa kanya na oo, magpabakuna ka. Pero kung kami mismo, sa grupo mismo ng healthcare workers, mayroon kaming takot at pag-aalinlangan, how much more the ordinary citizen. So when I did research about what the Rotary plans to do on your involvement with COVID vaccination, I was happy to note in the last part of this letter that there is a call from Rotary International for Rotary clubs all over the world to help in combating the growing force of vaccine resistance and misinformation. So when I discussed this with Sir George 2 weeks ago, I don't know what entered my mind. Maybe it was the Holy Spirit, sir. And I texted you na, Sir, baka pwede po tayong mag-collaborate kasi nararamdaman po namin sobrang maingay. Ang ingay-ingay. Sabi ko nga kay Sir, baka pwedeng i-4-way test kasi napaka-effective po nung campaign ninyo na 4-way test. Everybody is so familiar with it. Kasi ito po yung mga naririnig naming tanong ng bayan. kailangan kong magpabakuna? Sigurado ba yan? Epektibo ba yan? So, sabi ko, ano ba to? Totoo ba to? Is this for real? So, meron pong studying ginawa at lumalabas po that the concern for vaccine safety is a real concern. So, sabi namin, ano ba ang problema? Baka naiisip nila kasi baka masyadong mabilis. Sobrang bilis. Kasi dati, umaabot ng ilang taon bago magkaroon ng isang bakuna. So I said, baka gusto nating balikan yung stages, no, about vaccine development. So I tried to make this presentation po, which I called Vaccine Development 101. I'll just walk you through paano po ginagawa ang isang bakuna. So ito po yung regular na proseso. So, ginagawa po muna yung pagsastudy sa laboratory kung anong klase pong technology ang gagamitin. So, vaccines come in many forms. It can be an inactivated whole virus. Yung buong virus po, ina-activate po siya. Pwede po siyang part ng virus, parang antigenic component. Pwede din po siyang, the new technology now is the one using mRNA. So after that po, pag makita na siya sa lab in the animal trials na epektibo po siya, that's when we go into human trials. So phase 1 is the safety trial. We're trying to establish on a small group of normal, healthy volunteers the safety profile of the vaccine. Then, we do the efficacy trial. Pag proven na po na safe ang bakuna, gagawin na po natin yung efficacy trial. Dito po, mas marami na pong tayong subject na population. Then after that po, we do the evaluation trial. This one involving thousands already. And this can be multi-country or multi-sites and will have different groups of population. So for example po, for Moderna, I think they utilize almost 30,000 na study samples for their phase 3 trial. And then, na iba't ibang grupo po yun. Merong more than 65, merong less than 65, merong may high blood, merong wala. So, dun po natin kasi makikita kung ano po yung effect ng bakunang ito sa iba't ibang klase ng tao. And then, this part now, the phase 3 clinical trial is a 2-arm trial. Meron pong isang grupo who will receive the vaccine and another group who would receive either a placebo or ibang vaccine. So meron pong trial na placebo ang binigay. Meron naman pong iba who were given, I think, meningococcal vaccine as the control arm. So depende po yun sa study design. And then, in the study design po, tinitingnan po kung ilang porsyento ba doon sa nabigyan ng COVID-19 vaccine being studied will not develop the COVID infection within 14 days or ilan ang magdi-develop ng COVID infection within 14 days. At doon po sa nag-develop, ilan yung magiging grabe ang sakit. Now, before, kailangan po munang umabot ng final results bago po mag-a-apply sa FDA. Okay? So, final results po, of phase 3 trial. Bago po mag-a-apply sa FDA, and FDA will now assess for safety and effectiveness and will give a CPR or Certificate of Product Registration. Okay? Then, Vaxia was given a CPR. Okay? After a CPR is given, pwede na pong ibenta sa open market ang isang bakuna. And there can be large-scale marketing and distribution. Okay. Pag nagawa na po ito, phase 4 or post-marketing surveillance will have to be done. Kasi po, at this point, tinitingnan na po natin kung ano po yung magiging effect nito sa general population outside of the clinical trial. Okay. Lahat po ito ay ginawa pa rin po sa COVID-19 vaccines. All of them underwent the same phases. Ang pagkakaiba lang, phase 1 and phase 2, inaaral na po siya ng vaccine expert panel natin. Kasi po, nag-uunahan din po ang bawat bansa sa pag-place ng order. So, inaaral po siya. Hindi pa po tayo bumibili, inaaral pa lang. And another big difference is, hindi po natin hinintay ang final result ng phase 3 trial. The President in December, I think December 15, signed Executive Order 121 regarding the issuance of emergency use authorization for COVID-19 vaccines in the interest of national security because of the global threat of a pandemic. It gave authority now to FDA to use the preliminary data results of the phase 3 trials of COVID vaccines. So hindi na po ito po yung kakaiba Usually in the regular process, hihintayin pong matapos ang phase 3 trial para mag-apply po ng CPR. Pero at this time, preliminary data lang po ang ginamit ng FDA to assess for safety and effectiveness. And ito yung basis now for the issuance of an EUA. Because this is an EUA, hindi po siya pwedeng ibenta in the open market. The pharma company can only sell to government. And government will be the one to allocate and distribute. Okay. So, our government lang po ang pwedeng bumili. Bakit? Kasi EUA lang po siya. And being an EUA, kung meron pong adverse events na mangyari doon sa mga taong nabigyan ng bakuna, we cannot sue Pfizer, Astra, or any other company. Cannot sue them. That's why government has to take over that yung role na yon. Kailangan ang gobyerno ang magiging guardian ng buhay ng kanyang citizens nang bibigyan niya ng bakuna. They will be the one to monitor the adverse event and they will be the one to make sure that those people na God forbid magkaroon ng adverse event, sila po yung mag-take care of them, they will be the one to indemnify these people. Okay? Wala pong tanong at this point. Am I clear so far? Paki-thumbs up lang po sa sa reactions kung okay to proceed. Okay po. Sige po. Okay.
Yeah. May I suggest, we open now for question and answers. I think there are a lot of questions from our
sorry po, hindi ko po
audience.
na-monitor. Sige po.
Yeah.
Opo.
So I think maybe Andrew, you can just monitor it for people who wants to ask questions. The raise of hand.
So far, I don't see any questions in the chat box. But would you like to field some questions at this juncture and then continue with the talk, or would you want to finish first the talk?
Anyway, Andrew, we're at this point wherein we were discussing about on the safety, right? I just want to know, did our country participate in any of this safety trial? This was all done abroad, right?
Yes, sir.
We were never part of this.
Yes, sir.
Okay.
Magiging part po tayo. WHO is conducting a solidarity trial po. Magiging part po ang Philippines, but it's gonna be done this year pa lang po. Yung
may I ask,
all the other yes, sir.
Dr. Aileen, may I ask, because I've read some of these tests that they're done because these are all developed in US or in Europe. So ang yung mga tao na tinest nila, mostly are Caucasians. Okay? Wala bang problema for us, like we are here in the Asian region? Is there any difference with our DNA and their DNA? I mean, because they were using that as a basis. Sila lang ng pina-trial na phase 1, phase 2, phase 3, no? While how many Filipinos are part of that domain of testing? is there any difference? Can you enlighten us on that? Thank you.
That's a very good question po. And yes, sir, you are right. Yung ating genetic composition po as a race, there might be some differences on how our vaccine, how our immune system will react to the vaccine. So, isa din po yun sa tinitingnan namin kung what percent of the study population po doon sa phase 3 trials were non-white. Tapos kung ano po yung kanilang racial groupings, kasi yun po yung mga tinitingnan. So, I'm flashing now on the screen po for the information of everyone that currently there are more than 200 candidates under development. So, but only 16 is in phase 3 trials already. Yung iba po, nandun pa po sa phase 2 and sa phase 1. So ito po yun ano. So, you're right, Sir George, na talagang ano po siya, no? We have to take into consideration yung racial, ano po natin, yung genetic composition natin, being Asians and all. So, tama po kayo. Like for Moderna, out of 14,000, parang 1,000 lang ata, sir, yung non-white. So, meron naman pong ginawa in India, meron din pong ginawa in in China, tapos I'll check po kung meron din ginawa sa Indonesia. Kasi they're trying to have it in a multi-country trial. Dati po, pag bagong bakuna, usually the studies are done in third world countries or low and middle income countries. So, ngayon medyo baliktad. Nasa first world country po yung, nasa puti yung ginawang phase 3 trial. So, sabi nga namin, parang sila yung naging guinea pig ngayon. Tayo hindi. So, we will see po kung ano po yung magiging, ano nito, ano po yung magiging outcome. Because we have not received, yung lumabas po kasing phase 3 is the initial pa lang na result. They're supposed to come up with the next tranche ng results after 6 months ng monitoring by this month po, by February. And we'll see again kung ano po yung naging results po nila. So,
Okay, Dr. Espina, we'll let you finish your talk, but maybe just one more question before you finish, because there's a lot of questions now in the chat box, but June Palafox wants to ask a question. June?
Yeah, thank
Take
you,
it away.
Dr. Tina, and nice working with you, HPAAC. It really, yeah, to share it also, Dubai has 90% foreigners. So many of these foreigners from about 200 countries, they're being tested and accepted. And the other one, I want to share with the others that HPAAC, the group of doctors who are working with them, are encouraging more open spaces, the lungs of the city in our cities, and changing from pavements to parks, like making more parks to improve our immune system. The question I have is, Johnson & Johnson is supposed to be making a vaccine one time only. Unlike the other vaccines, you have to be vaccinated every 28 days. Are you aware of that, Dr. Aileen?
yes, sir. Yung ano po, most of the vaccines requires 2 doses, except for Janssen and Janssen. Yung Janssen and Janssen lang po yung single dose. In fact, there is also another candidate vaccine na oral ang route. So most of them po is by injection, either intramuscular or subcutaneous, and most of them requires 2 doses, except for Janssen and Janssen. Yun po talaga yung design po niya ng bakuna.
Thank you.
Regarding the open spaces, I hope we can work on that again, sir, kasi that's really something that is very, very important po. Not just for COVID, but also for NCDs and other diseases.
Yeah, we're learning from Hippocrates 400 BC and from Nurse Nightingale, more light and ventilation and so on. And unfortunately, some of our LGUs are converting open spaces to saleable, buildable areas. Yeah, thank you. Thank you, Doctor.
Yes, sir.
Okay,
So,
go
ang
on,
ano po
Doctor.
natin dito, opo, so to continue po so there is very limited supply of vaccines. Kasi kahit po we have so many billions of people in the world, um, there are several companies but they can only make so much in a very limited time and we're really racing after time. So ang ginawa ko ng Pilipinas, we started talking to many suppliers, many distributors. And the one on the left, ito po yung pinapakita ko na ito yung these were the vaccines that were studied by the vaccine expert panel. And based on their study, sabi nila, nako, magandang candidate ito, baka ito pwede tayong makipag-usap. And the one on the right po, I got this slide from a presentation of Dr. Ted Herbosa. And ang plano po talaga ng gobyerno natin is to have a vaccine portfolio. So hindi po tayo bibili ng isang klaseng bakuna lang. Kasi kahit na sabihin natin gusto ko brand A lang, hindi naman kaya ni brand A i-supply lahat ng kailangan natin. So, ang plano ng gobyerno po, kukuha tayo ng iba't ibang klaseng bakuna. Iba't ibang klaseng bakuna and then i-match natin doon po sa kakayahan ng isang LGU na masuportahan yung pag-distribute nito. Kasi halimbawa po, no, if you look at the table on the left, Pfizer, ang storage requirement niya is sub-zero. It's -70. Whereas, yung Astra, normal fridge temperature lang siya. So, yun po yung isang mga titingnan natin na kaya ba nating magdala ng -70 hanggang sa kasuluk-sulukan ng tawi-tawi? Or hanggang sa, kasi baka pagdating ho baka pagpunta pala ng Tacloban, kung frozen po siya, pag ice candy, inalusaw na siya. Now, importante po kasi sa bakuna na ma-maintain po yung kanyang temperature. So, all of these things po, nandito tayo. Ito po yung trabaho ng IATF Vaccine Cluster, headed by General Galvez. So, the Vaccine Expert Panel, sila yung nag-evaluate kung ano yung candidate na vaccine. Then, they were the ones who went into diplomatic engagement and negotiations. Then, pag na-issue na po, hindi naman tayo pwedeng bumili po ng bakuna na hindi po licensed sa Philippines. So, kailangan po talagang hintayin. As of today, dalawa pa lang ho ang may license. Pfizer and Astra. Meron pong 3 na ini-evaluate ngayon pero hindi pa po lumalabas ang kanilang EUA. Now, DOH is the one to procure. Okay? Ang problema po, ang sabi sa batas, ang DOH makakapag-procure lamang pag meron positive recommendation from HTA or HTAC. Yun po ang nasa Universal Healthcare Law at sa Bayanihan 2. The problem here is, HTA can only do its assessment for cost efficiency and yung conflict of interest using final data. Wala pa po yung final data. So, ang inaano po ngayon, there is actually a bill now filed in Congress. It was authored by Senator Pia and co-authored by Senate President Tito Soto, allowing HTAC to do its assessment using partial data. Ano po yung kaakibat ng HTAC assessment na to? This is a slide from Dr. Tony Dance. Titingnan po ng HTAC yung responsiveness to magnitude and severity, safety and efficacy, social impact, affordability and viability, responsiveness to equity, and household financial impact. So, lahat po yan titingnan. Napakahirap po ng trabahong to. Hindi po lahat ng doktor marunong nito. Isa po siyang master's degree abroad. So, meron po tayo nito. Create po yung HTAC ng Universal Healthcare Law. So, sila po ang gagawa nitong assessment na to. And it is only after positive recommendation na sasabihin nila, okay, DOH, this is what we can procure. DOH now will craft the National Vaccine Program together with the NITAG kasi it will include not just the acceptance of the delivery, the storage, but also the transport. Okay? And the distribution will be through the LGUs. Dito po papasok kayo ng Rotary because you have Rotary clubs all over the Philippines. Pwede po tayong tumulong dito. And then, monitoring of the adverse events shall be done by the NAFIC or the National Adverse Events Following Immunization Committee. Okay? So, ito po siya ang proseso. Mahirap. Kasi po, ang titingnan din po natin, maliban dito, is ito po, cold chain and logistics management. Saan po gagawin? Sino ang babakunahan? Ilan ang bakunador na meron? Sa isang araw, ilan ang kaya? Kasi po, halimbawa, ang isang vial, pag binuksan po natin yan, wala na pong balikan yan sa ref. Pag hindi natin yan nagamit, tapon na po yun. Sayang. Okay? So, may nakita po akong tanong dito sa chat box, which I would like to answer at this juncture. Are all the vaccines approved by our local FDA? Has they undergone animal testing? Yes po, ma'am. Yes po, sir. Sir Antonio Lopez. They did not do all the steps were followed. It's just that some of the tests were done concurrently or in parallel. So, hindi po siya tulad nung dati na pinatatapos mo na yung isang step, then gagawin yung isang step. So, ang ginawa po ngayon dito, meron pong nag-overlap po yung different na steps natin. Okay. So, with regards to asthmatic people, so kung meron po talaga tayong allergies to any of the vaccine components, hindi po kayo talaga dapat magpabakuna. The Philippine Association of Allergologists and Immunologists are coming up po with guidelines regarding people who are asthmatic and who have allergies para po it can boost your confidence. Okay. Yung yung available, yung bakuna sa Pilipinas na may EUA lang po, Sir Tiglao, sa pagkakangayon is Astra and Pfizer. Wala pa pong EUA ang Sinovac. Okay. So, Sir, Dr. Dairit, mamaya ko na po sasagutin dahil mahaba po yung tanong niyo. Okay. So, ito ngayon yung tanong ng bayan. After nung first question, di ba? Dapat ba ako magpabakuna? Ang sagot ko po, opo. Pangalawa, safe ba ito? Safe po at ang bakuna basta dumaan po siya sa tamang proseso. Ibig sabihin, may EUA po siya. Okay? Siya ay may emergency use authorization. Sino ang dapat mabakunahan? Paano pinipili? It's not a question of whether you have the capacity to pay, but whether it's about solidarity. Sino ang mas an equity? Sino ang mas kailangan ng bakuna? Sino ang mas nangangailangan nito? Who will benefit more from it? So this is the matrix that was used. Na kung very limited ang supply, titingnan natin yung mga areas sa Pilipinas na mataas ang community transmission, the number of cases, the risk of importation, at yun po yung nagiging basihan ng magiging prioritization list. Kapag ngayon po, pag very limited, ang magiging priority according to the WHO are the health workers at high to very high risk of acquiring and transmitting infections. Ito po yung nasa ospital na talagang nag-aalaga ng mga critical na pasyente. So kung ang inyong area, halimbawa, you're in a community with 0 cases, your health workers may not be in the same priority categorization as an LGU na napakataas po ng kaso. Like me, I am a healthcare worker. I am not a frontliner because my work is in policy, so I will not qualify under category 1A. Kailangan po akong magparaya para po sa aking mga kasamahan na talagang nag-aalaga ng may COVID. Okay? Then we have 1B. Okay. So each area will have to define and make their priority list. Kasi po, ang hangarin naman po talaga ng National Vaccine Program po natin ay ito. that all eligible Filipinos will have access to safe and effective vaccines, regardless of cultural or regional group, religion, political belief, or capacity to pay at the soonest possible time. Hindi lang po talaga pwede ng sabay-sabay. So, naka-priority listing po tayo. Okay? The core legal processes and public health values should be protected and upheld. Okay? We have the right to be given factual information. So, karapatan po nating malaman ang profile ng bawat bakuna para po, pag sinabihan tayo na tuturukan na tayo, alam po natin kung ano ang tinuturok sa atin and what we're getting ourselves into. And since pera po natin siya, we have the right to demand for full accountability of the national COVID-19 vaccine program. And lastly, the non-pharmacologic interventions and public health standards, they work. And they continue to work despite the presence of the UK variant, the South African strain, or whatever new variants. Masking, physical distancing, washing of the hands, the air circulation or the ventilation, the time spent, they will all work. They will still work. So they must be continued and maintained. So ang message ko po is, this is about moral responsibility. If you're a candidate for bakuna, you're at risk, you're at risk for getting infected and transmitting the infection, do it in solidarity with other people. This is about health equity and social justice. This is about, primum non nocere, do no harm. Hindi dapat po talaga ang ibibigay sa atin, alam nating safe. And lastly, this is about informed choice. So, yun po yung natin eh. Kasi no less than Pope Francis po, di ba? Kung nabasa nyo, ang sabi niya, taking the vaccine or having ourselves vaccinated is an ethical you should, something that hindi ka nagpabakuna at dapat ka talagang mabakunahan, ginagambol mo po ang buhay mo eh. At hindi lang ang buhay mo, kundi pati yung mga mahal mo na pwedeng mahawaan mo. So, herd immunity can only be achieved if a great majority of the people will be vaccinated. Vaccines don't work po. Vaccination does. So, kahit nandyan ang bakuna, kung hindi naman po tayo it will not work. But also, huwag po tayong makipag-unahan. Because the Pope also said in this same breath that vaccines should be made available for everyone, especially for the most vulnerable and needy. Yung mas nangangailangan. This is about equity.
Did you just lose our speaker?
I think Dr. Espina's frozen.
He may have lost Dr. Aileen.
Yeah. Unfortunately, I cannot answer the questions in the chat box. But
Yeah, I have a question too for Dr.
yeah, okay. Just raise your hands and we'll call on you.
Yeah.
If we can get Dr. Espina back.
Andrew,
Scan.
Andrew,
Yes, George.
yeah, this morning I posted some information regarding vaccine. Okay, this was obtained from the Office of Department of Finance. So of course, they're involved in the financing of the procurement of this vaccine. So as you can see there, that there will be enough vaccine to go to have all the citizens, majority of the citizens inoculated. People below 18 years old is not part of the vaccination program. Okay, but having said that, one of the concern is like what was discussed earlier is the mutation of this COVID-19. to different strain. Okay, and some of the manufacturers claim that it's effective, but there has been concern that has been raised that down the line they may have to tweak the vaccine that we're getting. So whether we can do it fast enough is one thing, no? And I, in some occasions, I represent the private sector that touch base with the IATF. Okay, and one of the important issue that is really the government must prepare to be able to do at least 200,000 to 250,000 inoculation a day. Okay? So that's a big challenge, considering when we were ramping up the PCR test, uh, it was it took us quite a long time to ramp up the testing. So that's why I don't know how the private sector can participate, whether the Rotary, because based on the write-up, all of these are under UA, emergency use authorization, and people who will do the inoculation has to be accredited by the Department of Health. And the other side that I just like to share with you is that the government must really have a good national ID or database installed. Without that, because the second booster shots could be 3 weeks to 6 weeks. Like the latest information I obtained is AstraZeneca is best if the booster shot comes 6 weeks after the first shot, after the first dosage. So it's a lot with each of the vaccine requires different protocol. So, but it's a challenge. Just hearing from Dr. Aileen, there are indeed areas that are a bit of gray areas. No, the testing has not really gone to completion, and I can sense why the fear of being vaccinated. But nevertheless, you know, having this it's a protection. It's like an insurance. No? I mean, for people to be, if they can be vaccinated, as long as they're not immunocompromised, one should be vaccinated. The I don't know how many of you have gone on board in the AstraZeneca, which is brought in by the by PA Joey Concepcion, no, the Go Negocio, and the Moderna is brought in by the ICTSI of Mr. Ricky Rason. Okay. And what they will do, from what I've heard, the arrangement of Mr. Rason with Moderna is Zuilik would be in charge of the logistic, because the refrigeration is not just regular refrigerator temperature; it's minus 20 degrees. So that is what I'd like to share with the group. Thank you.
Thank you, George. Yeah, I'm also wondering what the timeline would be for these vaccines. Would you have any
Uh,
idea? Are we talking second
Well,
quarter?
the note that I share, we were able to get from COVAX. No, COVAX is the program, World Health Organization, that is allocating vaccine for the poor countries, and we are considered a poor country. So actually, this vaccine coming from COVAX, I think will be arriving end of first quarter.
Yes,
Except I
sir.
don't know what brand,
It's
but
Astra,
there will
sir.
be vaccine. Huh?
Okay,
It's Astra. It's Astra and
AstraZeneca.
Pfizer.
Okay, yeah. Now you're back. There's some questions for you to answer,
so
Doctor.
Sorry
would you
po.
like to wrap up, Dr. Espina, or do you want to field questions?
Just field questions, but that was actually my wrap up na. I was just saying the
Okay,
four
thank you.
the four-way test.
Okay, I think we have a lot of questions on the chat box, but first, President-elect Louis would like to ask a question.
Good to see you back, Dr. Aileen, and thank you for your very interesting speech talk. You were correct. Vaccine resistance is perhaps due to adverse reactions, especially now that we have found out from you that the EUA was based only on preliminary data, which virtually renders immune the drug manufacturers from suit. May I know, because I keep hearing this about reactogenic reaction and allergic reaction, what's the difference between the two? And which of the different platforms which these vaccines are based on, whether it's messenger RNA, viral vector, or inactivated virus, produce the most adverse reaction? I think that is essential to having informed consent, Doctora.
Sir, thank you for that question po. Lahat naman po talaga ng gamot, ng bakuna, meron po talaga tayong possible na allergic reactions and adverse reactions. So, when we say allergic, ito po yung in the form of allergy. So, it can be as simple as nangangati, namumula yung injection site. It can be, ang ano po kasi natin is it can be local or systemic. So, our body will react to the vaccine because it's something foreign. And it is actually the reaction from our immune system that we want to happen. Because when we give a vaccine, we're basically provoking or poking our immune system to make a reaction against what was injected. So that it will produce soldiers, antibodies, panlaban against the virus when it comes. So what is injected to us is a part of the virus, whether it is the whole virus or an inactivated part or a part of it. So, pero hindi na po siya nakakakos ng sakit. But it is enough to trigger na yung immune system ay makapag-produce po ng panlaban. So that the next time around, may dumating na yung totoong kalaban, yung COVID, meron na tayong reserve force. May sundalo na tayo sa katawan natin. Okay? So, immunization really is actually an immune response. It's an immune reaction. Ayaw lang natin ng adverse. Yung mahihirapan talaga tayong huminga, yung talagang susuka-suka tayo, and there were reports na hindi nila ma-raise yung kamay nila, nagkaroon sila ng kulani, no? So, yun po yung mga ganon. And all of those things are being monitored. In all of the phase 3 trials po na ng mga nabakunahan nila, nireport po lahat yon. Nandun po yung report. And they compared the allergic reactions or the adverse events in both the vaccine group and the control group. Yung binigyan po ng placebo. And they found out, based on, I can give you link po to a YouTube channel made by a doctor, detailing yung result po ng per type of vaccine. Kasi iba-ibang bakuna, iba-iba po yung data. So, that kind of data po, yun po ang ina-analyze ngayon ng ating FDA. So, we can rest assured na pag sinabi nilang go yan, yung kanyang risk-benefit, no? The benefit outweighs the risk. Kumbaga. Pero meron po siyang warning na if you are I'll show it to you po, no, if I can share screen. Ito po, I'll show this. So, if you are older person, more than 65, if you are hypertensive, diabetic, okay? So, history of, say yes. Ito po yung say yes, say no rather. Persons who, teka, nagkawala-wala ako. I have 2 slides in my screen. Teka po. Persons who receive vaccines other than COVID-19, you don't receive it immediately after. Kailangan po may pagitan. So kung nagpabakuna pa lang kayo ng flu, huwag po munang magpabakuna agad ng COVID. Kailangan may interval. Pag meron po kayong history na nahirapan kayong huminga, nag-allergy kayo because of a bakuna, please tell your doctor na meron kang history na gano'n. May history po kayo ng allergy sa antibiotics, sa itlog, kasi yun po usually yung mga excipients, yung mga hinahalong ingredients. If you're below 18 years old, hindi po kayo good candidate because there is no data on children. Pregnant women, don't get yourself vaccinated because we have very limited data on its effect on the baby. Baka po magkaroon tayo ng, alala nyo yung phocomelia. Sir George, alam mo yung phocomelia? Alam mo yun? Yung napuputulan ng yung thalidomide babies, naalala niyo yung thalidomide babies? Yun po yung na mga baby na hindi nagkaroon ng extremities because of the effect of the drug thalidomide, which was being given to pregnant women para po hindi nagsususuka. So yun pala yung adverse effect niya, okay? Tapos kung currently meron kayong acute SARS-CoV infection, hindi po yun binibigay. Ngayon po, binibigay po siya dito naman po sa, teka sir ha, binibigay naman po siya dito po sa, kailan naman po siya binibigay? Dito naman po siya. Kikita niyo po, if
Yes.
it's safe for lactating mothers, yung nakapanganak na po. Persons with autoimmune disease, pag high blood po kayo, diabetic, older persons, persons living with HIV, kahit po may previous SARS-CoV infection na kayo, pwede pa rin po kayo mabigyan. So yun po. Kaya lang po, bawat tao talaga, iba-iba po yung magiging reaksyon. Kaya kasama po talaga siya. Kahit sa US po yung monitoring, they're asking people to report ano po yung mga naramdaman nilang simptomas. And so far, for Moderna and Pfizer, yung lumalabas, parang mas marami silang nararamdaman after the second dose. Yung first dose parang okay lang daw. Pero sabi ng classmate ko, yung second dose para siyang na-jab talaga. Ang sakit-sakit daw talaga nung ano niya. So, yun po. I hope I was able to answer your question, sir.
Yes, thank you. Thank you, Doctor.
Okay, we have two people in our meeting room with the questions. Back to Director June for the facts. You're raising your hand.
Yeah.
Yeah, go ahead.
Yeah, that question of President-elect Louis, I heard I shared it with you this morning from Father Nicanor Astriaco, the Dominican priest, molecular biology, PhD, MIT. He was talking to the Catholic bishops, and there's a lot of learnings from there. Like the allergic reaction, you stay when you are vaccinated at least 15 minutes so you get observed. Another one, if maybe the Rotary presidents all over the country can be the exemplars and show it in the media that we are confident with the vaccines, which the Dominican priest, Father Nicanor, encouraged all the bishops to do it and to lead, because one of the challenges, especially from the poor, how do you ask the poor lolo from the informal sectors to go back after 28 days? Because I think most Filipinos still skeptical. So this may be the initiative of leaders in Rotary clubs. Thank you.
Yes, Sir June. Kasi yun po talaga yung tracking, no? Kasi we can have a system talaga po na involve ang Rotary in monitoring po yung mga tao, and then transporting them to the vaccination centers po for their second dose. Magandang idea po yun, Sir June. It's really something that is worth thinking about as a Rotary initiative and contribution. In the US, I think some of the Rotary clubs there, tumutulong po sila dun sa vaccination centers. Like, nagta-traffic po ng mga tao, and then directing people where to go. I think yun po yung isang ginawa ng Rotary Club of Nebraska ba yun? Hindi ko lang sure kung ano yung nakita ko pong Rotary Club, pero they were very active po in the US.
Thank you, Doctor.
Director Philip, Director-elect Philip Sullivan.
Thank you. Thank you, Andrew. Hi, Doctor. Thank you very much for the very informative discussion. Could you comment on the issue of vaccine tweaking and or booster shot in response due to the variants, basically? How quickly does this actually happen or can happen, and how do you deliver these? Do you need to have another jab, for example, to deliver a booster later on? Because obviously there's a lot of concern about the fact that the variants cause the vaccines to behave differently in some locations in the world, apparently.
mutations po, viral mutations are very common. I don't know if you're familiar po with the flu vaccine na
Yeah.
wherein every year you get to have vaccinated for flu. Yun po talaga yung natural behavior ng viruses. Viruses really undergo mutation on a regular basis. As they move from one person to another, pwede po siya talagang mag-mutate. Some mutations are insignificant, some mutations are detrimental to the virus, some mutations are favorable to the virus. So, for example, the UK variant, wala po siyang impact in terms of the severity of the disease, but it makes the virus more transmittable. Bakit siya more transmittable? Kasi po, ang nangyari dun sa UK variant, according to the studies, mas kumakapit ngayon yung virus sa ilong. So, mas maraming virus inside our nose. So, such that when the person will sneeze, mas mataas po yung viral load na binubuga niya or inilalabas niya compared to the original strain. So, kung mas marami po siyang inilalabas na virus, mas marami siyang pwedeng mahawaan. So, they say that the UK variant, 1.1, variant B 1.1.7, is more transmittable, around 50 to 70% more transmittable. But, in terms of severity of disease, wala po siyang pagkakaiba. Thankfully, so far, the current vaccines available are still effective against the UK variant. It's still undergoing study po kung the current vaccines that we have, ano po yung magiging effect ng future na strains or variants. Like for example, the South African strain, kasi parang may initial studies na lumalabas na the South African strain, baka iba po yung magiging effect sa kanya nung available na bakuna. So everything right now is still under study. So if I have one conclusion is, we don't know what we do not know at this point in time. Yun lang po. Mahirap po talaga siya, to be honest.
Yes. Pero paano po yung pag-adjust ng vaccine to respond to the variant? Diba kasi parang sinasabi ng Pfizer, we can tweak our vaccine within so many weeks so that
Yes
it's
po.
more effective against the new variants, basically. Diba?
So,
Totoo ba yun?
Yes po, sir. Kasi ang ginagawa po, genomic sequencing. So, ngayon po, because of advances in technology, hindi po tulad nung 1960s na ang tagal bago maaral. Ngayon po with genomic sequencing, yung gene, yung talagang A, B, C, D, E, F, G ng virus po, kaya na pong i-map out yun. So, na-identify ka agad kung nasaan po yung point mutations. Kaya po siya may number ka agad, B1.11, ganun-ganun. Kaya na po yun talaga. At dun po sa tweaking na yun, kaya po talaga nilang ma-manipulate kasi po, the technology is really so advanced right now. Yun po yung ano dun. Ang ano lang natin dun is pag nag-tweak sila, may impact ba siya ngayon on safety profile? So yun po yung mga mino-monitor din po natin. How will be this new vaccine? Parang ganun po.
Thank you. We only have time for maybe two quick questions. So PP Tony and PP Cesar. Maybe we'll start with PP Tony. Please ask your question. Go ahead, PP Tony. Kila.
Thank you.
Okay, PP Cesar first.
My
Was
question
quicker
has
on the
something
draw.
to do
Go ahead.
with the sourcing of vaccine. After the government has defined or accredited the vaccine, there are several of them, then it will allow the government to import or buy this vaccine. Yet, there are cases where private sectors like Concepcion and Rason and others have been trying to buy their own vaccine for fear that there are not enough vaccine for everybody. And of course, there are smuggling of some vaccine that are not FDA approved. Yet, when you give it to a private sector, it will be difficult to follow or find out what has been the reaction of that vaccine. What have you been doing on this people trying to smuggle a vaccine into the country?
First, I would like to comment, sir, on the approaches to vaccine procurement that we currently have, no? So, we have different approaches, and meron po tayo through the COVAX facility, which is under WHO, and then dun din po yung sa national government efforts, yung may funding po, no, from World Bank, from ADB, and yung sa COVAX. Then we have partnership with the private sector. Ito po yung PPP arrangements that were brokered by Joey Concepcion, and this is the first time I heard about the one with Moderna under yung sinabi ni Sir George kanina, and also with the LGU. Okay? So, tatlo po yung approaches natin. But all of those po, dadaan po siya lahat sa national government. Kasi if I am not mistaken, yung PPP po halimbawa, I think the private sector will procure the vaccine, but it will be through the national government. And then 50-50 po ata yung sharing. 50% will have to be donated to the national government to be part of the national vaccine program, and 50% will be given to the private companies who bought it to be administered to their companies using the prioritization framework that was prepared by the national government. The same is true with the LGUs. With regards to the smuggling po, I defer to comment on it because I think it's a legal issue and it's something for national security, and we are not privy to ano po yung plano ng gobyerno natin on that matter. So, iwas pusoy lang po ako, sir. hindi po ako magko-comment doon.
Okay,
May disclaimer po ako, ang asawa ko po ay member ng Armed Forces of the Philippines. So, hindi na lang po ako magsalita.
Okay, very good.
Sir.
PP Tony?
Andrew,
Yes, go ahead.
Dr. Aileen, while we're waiting for the vaccine, in the meanwhile, why wouldn't they make available this drug, hypermaxin, which is supposed to be an effective prophylactic and cure for COVID?
Sir, I am part po, may disclaimer na naman ako, I am part po of the steering committee for the Living CPG, Clinical Practice Guidelines for COVID. And one of the things that we are currently studying is the use of adjunctive and prophylactic medicines like ivermectin po. Kasama po siya dun sa inaaral namin. We hope to be able to come out with the clinical practice guidelines for those things. Tinanong na po yan sa akin ni Sir George. And Sir George, I'm giving the same answer.
Okay,
Magpipresent na po ngayong February yung result po ng panel namin kasi nag-gather po muna kami ng evidences regarding these drugs po that are being used for prophylaxis. Don't worry, we will share it immediately once available.
Oh, that's a good news.
Andrew, can I just ask
ahead,
my last two questions? Okay. First is I please validate this. No, I heard that people get vaccinated, and of course the result is that they will have antibodies, no, after vaccination, but they can still be spreader. Is that accurate? That they can still spread? Okay, that's one. And secondly, my question is, can you intermix vaccine? Let's say you had one, let's say you took a vaccine, na bakuna ka, even after the second one, now you did not get antibodies. After that, can you take another brand of vaccine? Would it be, can it be done? Only these two questions. Thank you very much.
Sir, dun po sa nabakunahan ka na at nakakahawa ka pa ba, kung nabakunahan na po kayo, all the vaccines so far, yung profile nila doesn't convey 100% protection. So, meron pa rin po tayong certain percentage that you will get infected. Okay? But
But,
if
but can
if
you infect others?
yes, sir. Kasi po, if you get infected, you can still transmit. That is why it's very important pa rin po to wear the mask. Pero ang maa-assure ko po sa inyo is so far, yung mga profile po ng vaccines ngayon, sa nabasa ko lang ma'am, sir, 100% effective siya in preventing severe infection. So kahit mahawa po kayo ng COVID, 100% sure kayo na hindi kayo mamamatay o hindi kayo magkakaroon na ma-ICU or magkakaroon ng severe infection and you are not going to die from COVID. You may die from something else. But if you get yourself vaccinated, you develop the antibodies, you are not 100% sure that you will not get infected still but if you do get infected, you know it's gonna be mild. Yun po. Second question po, there are times, in my experience, hepatitis B vaccine, in my experience as a school physician before, nakapagbigay na po ako ng 3 dose, may booster dose pa, wala pa ring antibody yung pasyente. It happens. It is, po yun, nasa katawan po yun ng tao na talagang hindi talaga siya nagpo-produce ng antibodies. As to whether that person is, immune or safe, question mark pa po siya. Now, with regards to the COVID vaccine po, intermixing, no? So if you get first dose of brand A, the second dose should still be brand A. Wala pong study na pwedeng maghalo-halo. But your question is different because what you're saying is, nakapag 2 doses na ako ng brand A, and yet when I did antibody testing, maybe also, sir, we need to do antibody testing in sequence kasi baka it will just take time for your body to form antibodies kasi kailangan din pong quantitative titers. Baka meron po siya pero if you're doing qualitative test, yung mga positive, negative lang, baka hindi siya nagre-register but you may have antibodies in small amounts. But the question is, how big an amount is needed for you to be protected? Those questions are still to be answered in the coming days. Hindi pa po natin alam.
Dr. Aileen, follow-up question.
Yes po,
Follow-up
opo.
question. Kailan kaya lalabas yung study nyo sa mga drugs like ivermectin?
Ano po sir, hinahabol po namin na within Q1 po kasi alam po namin na burning issue po siya. Hinahabol po, hinahabol.
Okay,
Dr.
thank
Aileen.
you.
I just want to add on to what Governor Tony is concerned, no, about ivermectin. I have shared my thoughts with some of the IATF. I said, what's important for the country is really, aside from the vaccine, is we must have the screening test that is affordable and available. If you look at what's happening to our economy, it's because of this fear, the fear of getting infected. So if you have enough testing to go around and cheap enough to detect those who are infected, you remove the cloak of invisibility of COVID-19. As of now, why we are afraid, parang invisible siya. Okay? But if you do enough testing, then you remove that cloak of invisibility and we can gradually normalize our economic activities. And aside from the prophylactics. So that's one thought that I'm sharing with some of the higher ups, that they should also of course, vaccine is important, but the testing, the screening is just as important. Just a thought. Thank you.
Very quick
Just to
question.
just to reiterate this slide, Sir George.
Yes.
If you notice po, dito po sa may daga, ang kinakain ninangat-ngat ng daga is fast and sensitive testing and tracing. Very, very important po talaga siya.
Yeah.
Kaya siguro siya ninangat-ngat ng daga, sir, kasi daming problema, daming kumukontra.
Okay.
So, I agree with you, sir. Very, very, very important po talaga. And we welcome the saliva test actually ng Red Cross. In fact, I'm doing a meeting tomorrow. May disclaimer na naman ako. I'm actually a technical consultant for a company, an IT company, and we're doing a session with them tomorrow to discuss the ramifications of the COVID saliva test with them po.
Yeah. I don't know if,
Andy,
yes,
one last question, very quick.
very quick. Go
Uh,
ahead, PP.
What has become of the antibody test that was supposed to determine if a person has the antibodies?
Sir, it's still available po. It's available. Ang ano lang naman noon was we were against the antibody test being used as a screening
Yeah.
test for diagnosis. But
Yeah.
this time around, sir, I would fully support that if you get yourself vaccinated, you have yourself tested talaga for testing kung nag-develop po kayo ng antibody. Because that's proof of the pudding na talagang nag-develop. But you do the test probably after a month to give your immune system time to develop the needed antibodies also. But so far po, yes, sir?
Now, what about those who were naturally infected but did not develop serious illness or probably were asymptomatic? Would they have the antibodies already? Suppose they took the antibody test, would they still need to be vaccinated?
Ang ano po dun, sir, no, according to the SAGE, if you had a previous infection kasi, we don't know, as you've said, kung nag-develop ka ba ng enough antibodies. Kasi meron pong iba na pag mild lang siya, parang konti lang yung antibodies. And we don't know how long will the natural antibodies persist. So, getting yourself vaccinated, it will act as a booster to your immune system. You can choose naman po, like I had a patient a month ago, he had COVID, tapos he was asking me now kung magpapabakuna ba siya. So I look at his profile and I said, you just had COVID, maybe you can wait. Hindi ka muna makipag-unahan doon sa pila because you can still wait dahil we really pinatest ko po siya, may antibodies po siya ngayon, and sabi ko nga, you can afford naman, let's monitor your antibodies just to satisfy my curiosity kung how long magpi-persist po yung natural antibodies po niya. Depende rin po kasi sa katawan ng tao kung gaano po tayo kadami. Unlike yung chickenpox na talagang natural infection, lifelong immunity, with COVID, we still don't know, sir. I will be honest po, hindi ko po alam how long it will persist.
Okay, thank you.
Okay, thank you. We have several questions in the chat box, and PP Fred is also raising his hand. I don't know if President Peter, could we extend a little, or could we do this after? I don't know if Dr. Espina can stay.
It's okay.
Sir, I just would like
It's
to
okay.
address the question po of the vaccines using
Okay.
embryonic tissues.
Yes, there's one from about the church. Yes.
Wala pong embryonic tissues or fetal cells that are included sa recipe or doon po sa bakuna. But may but po ako, may gumamit po talaga ng fetal cell lines during the development ng vaccine. Fetal cell lines po are there was an abortus way back in the 1960s na yung cells na yon nung na-abort na baby were kept in a test tube in the lab. And then yun po, during the process of the development of the vaccine, they were tested against the fetal cell line. So kumbaga, yung mga cells na yun ng abortus na yun, binuhay at pinadami through the years, at ginagamit po talaga yan during vaccine development to test for efficacy, for safety. Pero wala pong kinuhang wala pong isinangkap doon sa bakuna. And even the Catholic Church made a comment on this. And just so you know po, Pope Francis and Pope Benedict already received their bakuna po. Nagpabakuna na po yung dalawang pope.
Okay, PP Fred, take it away. Last question.
I don't know whether this has been covered, I'd like to raise the matter of convalescent plasma. It was being used for therapy. I don't know whether that progressed. I don't hear much about it. And can it be also transfused to healthy individuals, so the healthy individuals can develop the antibodies in their blood? Thank you.
Pressure naman ako, UP President, sir. Good afternoon, sir. Um, yes po, yung plasma therapy is a form of passive, no? Passive immunization somehow. Kasi it's like preformed antibodies that are being infused to you. Kasi yun po yung theory that yung people who were severely sick with COVID in the beginning, nag-harvest po kami ng plasma from people na newly recovered. Tapos yung antibodies nila, hopefully, tinatransfuse para may panlaban po against COVID. May ongoing studies po yan, sir. I think PGH is part of the trial on convalescent plasma use. So, hindi ko po nababasa pa yung kung ano po yung result, but ginamit po talaga siya natin in as part of the protocol po for COVID. And then, in one of my slides kanina po, I said that for persons who have previously received antibody therapy, yung convalescent plasma, the SAGE does not recommend po na mabakunahan kayo agad ngayon kasi baka po magkaroon ng cross reactions po yung preformed antibodies that were given to you. Kasi hindi po natin alam yung behavior din po ng preformed antibodies in the immune system, tapos bibigyan po kayo ng booster, then your own immune system will form antibodies, baka po magkaroon ng giyera sa loob ng katawan po natin. So,
Masaya yan.
May fireworks, sir.
How long will
Salamat.
that take for that take for it to, to go down the levels of the passive immunization?
I think it's still, sir, minomonitor po nila.
Okay. So they
It's
can
really
monitor.
kasi siya, sir, kailangan longitudinal po yung studies. And right now, we're just 1 year dito po sa pag-aaral natin sa COVID. Kaya nga po, we cringe whenever we say na expert sa COVID. Kasi sabi namin, 1 year is too short a span of time para mag-claim ng expertise on a subject matter na mas marami yung unknown. Para siyang iceberg. We are only seeing the tip of the iceberg. There is still so much that is yet to be known about COVID po.
Thank you. Okay, with that, we'd like to just get a response from our President Peter.
Thank you, Andrew. Okay, it is always a good practice to consult with and listen to our experts. When we were kids, doctors and nurses came to our school to administer some vaccines to us. They told us the injections were good for us to prevent us from getting sick. But to us kids, we were more afraid of the needle more than what a certain disease could cause us. But we did it anyway because we trusted our parents, our teachers, as well as the doctors and nurses whom we regarded as experts. Some things never change. We still go to the experts when we need something fixed or when we want to get credible opinions, especially when it comes to our health. They say that an expert is someone who has made every possible mistake in a small field of study. I know it's not a very assuring description of an expert, but I guess that's how they become experts. To be an expert needs a lot of training. Even in court, we have to establish the qualifications of an expert witness before they are allowed to testify as such. But what happens when the so-called experts give conflicting accounts and advice? That basic trust starts to wane and dissipate. In the early part of this pandemic, experts varying their opinions in handling this medical crisis. Some experts opine that the way to handle it is through complete lockdown. Others ruled lockdown out. They claim that we have to deal with the pandemic just like any other virus. We need to learn to live with them until our bodies develop natural antibodies to fight off the virus. They claim that all we have to do is to observe basic hygiene protocols, just like wearing face masks, observing a reasonable distance, and frequent washing of hands or applying alcohol. Yet, even with the basic hygiene protocols, experts offer different pieces of advice. On wearing face masks, they told us to wear an N95 mask as it is the only type of face mask that is effective in warding off the virus, only to be told later that washable face masks and medical masks are more than enough. On frequent hand washing of hands, experts told us to sing the happy birthday song twice while washing our hands to make sure the virus is dead. Then other experts claim that there is no need to do that, since the virus is so sensitive that a mere contact with a bubble of soap will immediately cause it to disintegrate and die. Even the terms used by experts change. We were told to maintain social distance. Then our mental health experts told us to use the term physical distance instead, as social distancing connotes that we distance ourselves altogether from society. It is bad enough that with all the doubts created by various conflicting opinions of our medical experts, we are forced to turn to the internet for guidance. Worst, if we turn to politicians for all the answers. We are blessed that we live in a time when everything we want to know about is in the web. With the easy access to information all over the internet, the temptation to rely on what we read or watch on the net is simply great. But that's not the way to go about in dealing with this pandemic, for the devil is in the details. Then we get to listen to our favorite politicians who carelessly share their opinions left and right without any scientific basis, but based solely on what they think are logical solutions. Although I'm sure they were only joking in suggesting that we use gasoline to disinfect our face masks or to inject bleach solution on people to kill the virus. For to assume otherwise is simply absurd and ridiculous. Year 2021 is regarded to be the year of hope with the development of the vaccines, although certainly this is no reason for us to let our guards down. We're not yet out of the woods. The vaccines from Pfizer BioNTech, Moderna, Oxford, AstraZeneca, China's Sinopharm, and Russia's Sputnik 5 are said to be not readily available until the second quarter of the year at the earliest. The testing and approval process of vaccines will still take quite some time, not to mention the shipment period of the vaccines that will require delicate handling. We note that it was the Russians who were the first in developing the first vaccine for the COVID-19 in August last year after having only been in clinical trials for less than 2 months. Putin said that the vaccine is safe, noting that it had already been given to one of his daughters, although I wonder why he did not have it administered to himself first. Well, we don't have to accept Putin's declarations as gospel truth, for it was also the Russians who taught us one of their proverbs, trust but verify. It is said that the successful administration of the vaccines is key to the full reopening of the economy. I totally agree. Let us hope and pray those who develop the vaccines that will be available to us in the months to come will be able to show us that they have earnestly followed all the medical protocols in coming up with the vaccines as our speaker has discussed to us. Then and only then can we expect the public to give back their trust and have themselves inoculated. Thank you, Dr. Aileen Riel-Espina, for sharing with us your time and expertise. Thank you for sharing us your very valuable insights on COVID-19 vaccines. On behalf of the Rotary Club of Makati, our lovely aunts, our district governor, Chacha Camacho, the other Rotarians from the different clubs in our district, special to my classmates, the Perfect Vision presidents, our Rotaractors, and all the other guests in attendance, please accept our heartfelt gratitude for taking time in being with us today. Once again, thank you. And as tokens of our appreciation for your time and service, we shall be giving you a copy of our 50th anniversary coffee table book, which contains our club's 50 years of community service and fellowship together with a bottle of red wine for you to enjoy while going through the. Thank you again.
Thank you.
Good
Mga
afternoon.
salamat.
Thank
Before
you.
we adjourn, may I ask each and everyone to open your cameras for our group pictures. Okay.
Okay.
This 23rd regular meeting of the Rotary Club of Makati is hereby adjourned. Thank you everyone for coming.
Thank you.